The first time a person loses control of their own body without warning, even for a few seconds, something fundamental breaks inside them long before any diagnosis is ever spoken. I'm Dr. Emily Carter, and if you were sitting across from me right now, I would not start by naming your condition. I would start by watching how you're holding your hands. I would notice the tension in your shoulders, the way your eyes keep searching my face as if you're trying to read the future before I speak it aloud. Epilepsy and seizures carry a weight that few medical words do. They don't just describe what happens in the brain. They describe fear, unpredictability, loss of control, and the quiet question patients are often too afraid to ask out loud. Am I safe inside my own body? What most people don't realize is that a seizure is not chaos. It is not randomness. It is not the body betraying you without reason. A seizure is the result of highly organized electrical activity in the brain going wrong in a very specific way. The brain is an electrical organ. Every thought you have, every movement you make, every memory you recall is driven by tiny electrical signals passing between billions of neurons. Under normal circumstances, those signals are tightly regulated. They fire when they should, rest when they should, and coordinate with each other in precise patterns that keep your consciousness stable and your body under control. During a seizure, that balance is disrupted. A group of neurons begins to fire excessively, synchronously, and uncontrollably. It's as if an electrical storm forms in one part of the brain, and depending on where that storm begins and how far it spreads, the experience can look very different from person to person. Sometimes it stays localized, causing subtle symptoms that are easy to miss. Sometimes it spreads rapidly across the brain, overwhelming systems that control movement, awareness, sensation, or consciousness itself. I often hear patients say, "But I didn't shake," as if that somehow disqualifies what happened. I need you to understand that seizures are not one single experience. They exist on a wide spectrum. Some seizures involve dramatic convulsions that are impossible to ignore. Others involve brief lapses in awareness, moments where time simply disappears. A person may stare, stop responding, smack their lips, fidget, or feel a sudden wave of fear, déjà vu, or nausea without understanding why. These moments may last seconds. They may leave no obvious trace, and yet they are seizures all the same. Epilepsy, as a medical condition, is not defined by a single seizure. Anyone can have a seizure under extreme circumstances such as high fever, severe infection, low blood sugar, or head trauma. Epilepsy is the tendency of the brain to generate recurrent, unprovoked seizures. It means the brain has developed a pattern, a vulnerability, a lowered threshold for these electrical storms to occur again. That realization alone can be devastating. Patients often sit silently when they hear it, nodding politely while their internal world collapses into uncertainty. Why does this happen? Sometimes there is a clear cause: a prior brain injury, a stroke, a tumor, an infection, a genetic condition that affects how neurons communicate. In these cases, epilepsy is a consequence of a visible change in brain structure or chemistry. But many times, especially in adults, we never find a single clear cause, and that ambiguity can be deeply unsettling. People want something to blame. They want a reason that feels concrete. When it's not there, the mind fills the gap with guilt, fear, or self-doubt. I want to say this clearly, and I would say it slowly if you were here with me. Epilepsy is not a weakness. It is not a failure of character. It is not something you caused by being anxious, emotional, or imperfect. It is a neurological condition rooted in how the brain functions at a cellular level. What makes epilepsy particularly difficult to live with is not just the seizures themselves, but the anticipation of them, the waiting, the constant mental calculation. What if it happens here? What if I'm alone? What if people stare? That persistent vigilance can be exhausting. Many patients describe living in a state of low-level fear that never fully turns off. Even on good days, it's there in the background, shaping decisions, limiting spontaneity, shrinking the world a little at a time. Some people experience warning signs before a seizure, something we call an aura. This might be a strange smell, a rising sensation in the stomach, a sudden emotional shift, a feeling that something is deeply wrong without being able to explain why. These moments can be terrifying, because the person knows what may come next but cannot stop it. Others have no warning at all. The seizure simply takes over, and consciousness is interrupted without consent. After a seizure, there is often a period of confusion, exhaustion, headache, or emotional fragility. The brain has just been through an electrical storm, and recovery takes time. Patients may feel embarrassed, ashamed, or frustrated, especially if the seizure occurred in public. I have seen grown adults cry in my office not because of the physical experience, but because of the loss of dignity they felt afterward. One of the most harmful myths surrounding epilepsy is that it is always obvious. In reality, many seizures go unnoticed or are misinterpreted for years. Brief staring spells in children are labeled as daydreaming. Sudden mood shifts are blamed on personality. Episodes of confusion are attributed to stress. People normalize these experiences because they don't want to confront what they might mean. Families adapt quietly. Life rearranges itself around symptoms no one names.